Welcome to This Week in Physical Medicine and Rehabilitation. This week we're covering 10 notable papers spanning novel interventions for chronic musculoskeletal pain, optimization of neurological and stroke rehabilitation, and post-surgical functional risk stratification. Let's dive in. We begin with new evidence in musculoskeletal rehabilitation, focusing on how targeted interventions and specific training parameters can optimize recovery for common conditions. In the archives of Physical Medicine and Rehabilitation, a double-blinded sham-controlled trial evaluated the mid- and long-term benefits of ultrasound-guided percutaneous electrical nerve stimulation combined with exercise for chronic lateral elbow pain. 49 participants were randomized to receive either active percutaneous electrical nerve stimulation targeting the radial nerve or a sham procedure alongside a 4-week exercise program. At the 1-year follow-up, the active intervention group demonstrated large sustained improvements that exceeded minimal clinically important differences, including a reduction of over 25 points on both the numeric pain rating scale and the patient-rated tennis elbow evaluation. Impressively, more than 90% of the active treatment group reported moderate to large perceived improvement at 1 year. This suggests that incorporating targeted percutaneous electrical nerve stimulation into standard physiotherapy regimens can provide profound, long-lasting relief for patients struggling with persistent lateral epicondylalgia. When designing exercise protocols for chronic tendinopathies, clinicians often debate how strictly patients must avoid pain. Another study in the archives of Physical Medicine and Rehabilitation addressed this issue by investigating adherence to different pain thresholds during a 26-week exercise intervention for chronic rotator cuff tendinopathy. 84 patients verified by ultrasound were randomized to either a pain-allowed protocol, where they could exercise with pain up to 5 on a 10-point scale, or a pain avoidance protocol keeping pain below 3. The investigators found that patients adhered highly to their assigned pain thresholds, with mean exercise pain levels of 2.8 in the pain-allowed group and 1.6 in the pain avoidance group. While exercise and physiotherapy session attendance remained high across both groups, logbook adherence declined over time, particularly after week 20 when active supervision ended. This indicates that clinicians can safely offer patients a choice between pain-free or pain-tolerated shoulder exercises, but they should anticipate a drop-off in self-monitoring once supervised sessions conclude. Understanding the biomechanical drivers of pain can further refine our rehabilitation strategies, particularly in older populations. In the American Journal of Physical Medicine and Rehabilitation, researchers utilized data from over 4,000 participants in the Osteoarthritis Initiative to explore the relationship between self-reported pain during stair climbing and knee muscle strength imbalances. Participants reporting asymmetric pain, meaning pain predominantly in the right or left knee, exhibited significant strength deficits and greater muscle strength asymmetry in the painful limb compared to those with equal bilateral pain. Interestingly, the ratio of hamstring to quadriceps strength did not differ significantly between the groups. These findings suggest that asymmetrical knee pain during stair ambulation is closely tied to underlying interlimb strength imbalances, signaling to clinicians that rehabilitation for unilateral knee osteoarthritis should place a heavy emphasis on restoring bilateral strength symmetry. In home-based rehabilitation, simple adjunctive breathing techniques can also play a meaningful role in pain and functional recovery. A study published in Disability and Rehabilitation investigated a 4-week hybrid telerehabilitation program for 54 patients with chronic non-specific low back pain. Participants were randomized to receive core stability exercises alone or combined with either diaphragmatic breathing or the abdominal drawing-in maneuver. Compared to core stability exercises alone, both breathing combined interventions led to greater short-term reductions in pain intensity and functional disability, with benefits partially maintained at 3 months. Both breathing groups also demonstrated superior improvements in kinesiophobia, proprioception, and postural control under eyes closed conditions, with no significant differences observed between the two breathing modalities. This highlights that incorporating structured breathing training into core stability programs is a simple, effective, and easily translatable telerehabilitation strategy to enhance functional outcomes. Next, we turn to neurological rehabilitation, where recent studies shed light on often overlooked symptoms, optimal training parameters, and the delivery of care during critical transitions. Writing in the archives of Physical Medicine and Rehabilitation, researchers presented a sobering look at sexual function during primary inpatient rehabilitation after spinal cord injury. Analyzing population-based cohort data from 605 individuals in Switzerland, they discovered a major gap in care. At approximately 5 months post-injury, sexual function outcomes were documented as unknown, for 67% of female and 46% of male patients. Among those with recorded data, rates of dysfunction were exceptionally high. For females, altered or absent reflex genital arousal, W7%, and orgasmic dysfunction by 60%. For males, altered or absent psychogenic erection, reflex erection, ejaculation and orgasmic function ranged from 70 to 76%. Injury severity and older age were strong predictors of dysfunction. This study highlights a critical need for rehabilitation teams to proactively assess and address sexual health during early inpatient recovery, rather than leaving these vital quality of life concerns unaddressed. When addressing respiratory complications in spinal cord injury, the intensity of rehabilitation appears to be the primary driver of success. A retrospective analysis. Lesion and training specific parameters on respiratory muscle training outcomes in a Swiss rehabilitation hospital. Using machine learning and linear modeling on real-world clinical data, the researchers found that training intensity, specifically, setting the inspiratory resistance as high as possible, and the total number of training sessions had a far greater impact on improving inspiratory muscle strength than the patient's age, gender, or even the level and severity of their spinal lesion. Their findings suggest that therapists should focus on high-intensity resistance training and motivate patients to continue the training for as long as possible, preferably exceeding 3 months, to maximize respiratory recovery. In stroke rehabilitation, managing secondary complications like fatigue requires a nuanced understanding of its relationship with cognitive and linguistic deficits. A cross-sectional study in the Archives of Physical Medicine and Rehabilitation explored the relationship between post-stroke fatigue and aphasia severity in 73 adults with chronic post-stroke aphasia. Surprisingly, Bayesian regression analysis revealed that patients with milder language impairments reported significantly greater post-stroke fatigue across multiple dimensions, including severity, distress, and interference. The author suggests that individuals with milder aphasia may experience a higher fatigue burden due to elevated communication expectations in daily life and the substantial compensatory cognitive effort required to navigate conversations. This emphasizes that clinicians must routinely screen for fatigue across all levels of language impairment, recognizing that mild aphasia carries significant hidden cognitive and physical costs. Supporting stroke survivors during the critical transition from hospital to home is another area where delivery models are rapidly evolving. A scoping review in clinical rehabilitation mapped 18 telerehabilitation studies initiated during the hospital to home transition, categorizing them into caregiver-mediated, technology-driven, multidisciplinary, and mobile health-supported models. The review found that while technology-driven motor telerehabilitation is highly feasible and yields motor outcomes comparable to conventional face-to-face care, it rarely demonstrates superiority. Caregiver-mediated models did not show significant primary mobility benefits but did suggest psychosocial advantages for caregivers. In contrast, multidisciplinary transitional care models frequently improved quality of life and self-management. The authors noted that participation-level outcomes and community reintegration remain major evidence gaps in the literature, suggesting that future telerehabilitation programs should focus on multidisciplinary coordination and real-world participation. Finally, we look at how preoperative and discharge characteristics can help us predict long-term functional recovery and guide postoperative care after major surgeries. In the American Journal of Physical Medicine and Rehabilitation, a retrospective study of 162 patients undergoing decompression surgery for lumbar spinal stenosis evaluated the impact of frailty on long-term outcomes. Using the Edmonton Frailty Scale, 37% of the cohort was diagnosed with frailty. Although both frail and non-frail patients achieved significant improvements in health-related quality of life after surgery, frail patients had significantly lower physical activity and social participation scores at 1 year. Multivariable analysis showed that frailty was associated with a 2.5-fold increase in the odds of low physical activity at 1 year. This indicates that while surgery successfully addresses pain and quality of life, elderly patients with frailty remain at high risk for ongoing social isolation and reduced activity, suggesting they require targeted, individualized physical therapy and social support postoperatively. Predicting functional capacity is also a vital component of recovery after cardiac surgery. A retrospective cohort study in the Archives of Physical Medicine and Rehabilitation developed and validated a machine learning model to predict reduced exercise capacity, defined as a peak oxygen uptake of less than 14 milliliters per kilogram per minute, at 3 months after cardiovascular surgery. Analyzing 590 patients, they found that nearly 24% demonstrated reduced exercise tolerance at 3 months. Their random forest model achieved high predictive accuracy, identifying the percentage of isometric knee extension strength at hospital discharge, the echocardiographic E to E prime ratio, and high-density lipoprotein cholesterol levels as the primary predictive factors. Measuring lower limb strength at discharge is therefore a simple, powerful, and modifiable predictor of long-term exercise capacity, offering clinicians a clear target to identify and refer high-risk patients for intensive cardiac rehabilitation. If you only have time for one paper this week, make it the study by Albert Lucena and colleagues on ultrasound-guided percutaneous electrical nerve stimulation for chronic lateral elbow pain. This randomized controlled trial provides robust, one-year double-blinded evidence for a highly targeted, minimally invasive intervention that, when paired with exercise, delivers dramatic and lasting improvements in pain and function for a notoriously stubborn clinical condition. Here are the key takeaways from this week in physical medicine and rehabilitation. First, for chronic lateral elbow pain, adding ultrasound-guided percutaneous electrical nerve stimulation of the radial nerve to an exercise program offers large, clinically meaningful, and sustained improvements in pain and function up to 1 year. Second, when prescribing exercise for rotator cuff tendinopathy, patients can adhere equally well to either pain-free or pain-allowed protocols, giving clinicians and patients the flexibility to choose the approach they are most comfortable with. Third, sexual dysfunction is highly prevalent but severely underdocumented during inpatient spinal cord injury rehabilitation. Proactive assessments and discussions are urgently needed, especially for older patients and those with complete injuries. Fourth, in post-stroke care, milder language deficits are paradoxically associated with greater post-stroke fatigue, likely due to higher cognitive demands and communication expectations, highlighting the need for routine screening in this population. And finally, measuring knee extension strength at hospital discharge after cardiovascular surgery is a key predictor of long-term exercise capacity, offering a clear target for early rehabilitation risk stratification. That's your roundup for this week in physical medicine and rehabilitation. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence which can make mistakes. Always review the original source materials.